one of the focuses that we've seen increase, in conversation across the country is related to equity and making sure that people from historically marginalized groups have access to vaccines. And we know that New Mexico recently launched a vaccine equity program. Can you talk to us about that program and how it works, why it matters, who it helps?
Absolutely. This is a state that has to get the equity distribution right. We're a minority majority state, and that's not to say that that shouldn't be the case in every state. But here, we are really clear about both the benefits of that and the challenges in reaching high-risk populations. So what we saw, as every state did, that the majority of individuals in long-term care facilities, and still, unfortunately, far too high a percentage of healthcare workers are non-minorities. And so you have I think, artificial issue where we're all concerned about the lack of minority representations in getting vaccines out. So we looked at that data and we've decided that we can do two things better. One, we can get much more granular at the zip code level to really make sure that we're reaching high-risk minorities. So you've got an equity distribution population. And two, we're actually going to use census data as we go granular so that we have a vulnerability index factor that looks at everything from socioeconomic status to your minority or racial status and household circumstances. That means that we're going to take a certain percentage of vaccine off the top. As long as this amount of vaccine, and now with Johnson & Johnson, continues to increase and come to the states, including us, we think that we could do 25% off the top. We'll go to this vulnerability index system. We'll bring vaccine to you, mobile vehicles to you, mobile clinics to you, and set aside these vaccines and do whole populations, whole sovereign nations. We'll do all of that work statewide, no matter how hard to reach you are. And then we're going to really assess every single week whether we're accomplishing our goals to reach every single minority and ethnic group in the state in an equal, equitable, effective manner, which will also help us reduce spread and risk, because these are the populations that have a higher mortality rate, have less access to healthcare, and when they do have access to healthcare, they're sicker and more at risk for longer hospital stays. So we know how valuable and important it is. If we're going to save more New Mexico lives, we're going to keep more people out of New Mexico hospitals, and we're going to reduce the rate of transmission in the state.